Andy, as a patient advocate, let's talk about why we're hearing women avoiding prevention screenings like mammograms where they need to go to them. Why are they doing that?
Yeah, there's a couple of reasons. One is oftentimes they talk to their family or friends and they've heard of a painful experience or an uncomfortable experience. And the second one is really around anxiety associated with being frustrated. Um, Oftentimes, if a woman is told that there was something suspicious found during her exam, it can take multiple days, even weeks, to get that answer of going from, I think I found something, to knowing whether yes or no, they actually did find anything. And the wonderful thing is there's great partners like Michelle and the team at St. Luke's that are really working with us to change that paradigm. And that really is centered around something called the OneStop Clinic.
Yeah, and I think this is amazing they're doing this. Michelle, let's talk about this one-stop clinic and how it's different from other types of clinics.
Yeah, the OneStop Clinic is really based in changing kind of the philosophy around the care for the patient and getting this diagnosis. Everything that we do, we want to be reducing her anxiety and expediting her results, right? And so we do that through a very, very coordinated team care approach, starting with a phone call from her nurse navigator that really starts to educate her and prepare her. From that call, we're starting to prepare her for what this journey is going to look like, and not just at her appointments, but beyond that, because obviously these patients are at a high suspicion and there's just a different enveloping the patient that the team does, and getting them in and getting their imaging done and getting them to results.
Yeah, I'll tell you, this is so great. I mean, you just mentioned some of the benefits of the one-stop clinic, but can we talk a little more about what it's going to be the experience for these patients?
Yeah, that patient, she's already made that relationship with her breast nurse navigator, and that navigator is going to greet her the day she arrives. We're doing an individualized exam approach based on what we're seeing on imaging or what her symptoms are. And we have all the technology in one site for one appointment with this patient. She knows she is our full focus for that appointment. Patients often remark that this experience, they know that this is being done with them, and it's not the type of experience that you feel, well, that happened to me. So the patient knows that she's at the center of our care. The team does a phenomenal job in being able to have very open and honest conversations with her, all while, like I said, just providing this compassionate care and helping to keep her anxiety levels very, very low.
This is so important. And Andy, I want to bring you in and talk again that we said it before. Women have anxiety. They're scared to do scheduling for their mammograms, and it can be uncomfortable. But I think the One-Stop Clinic is doing more with that, with these advances in breast care to address it, aren't they?
They are. Just like Michelle was talking about that patient centricity, it's the same approach and philosophy that we have when it comes to our design and innovations at GE Healthcare. And in 2016, with the introduction of Senograph Christina, it was the first innovation in mammography that actually had a piece of equipment that was designed for women by women. In addition to that, we recently introduced another innovation called Duetta. So you can see it, I'm holding it in my hand. It's a remote control. We give it to a woman when she comes in for her exam, and she can physically control the amount of compression that she's experiencing. And that's great because it reduces her anxiety, but more importantly, the more compression she can apply, the better the quality of that image is, which allows the physician or the radiologist to be able to see if and when cancer may be in that image.
This is so important, you two. And Michelle, we have to bring up that it's very important we start talking about this. It's very important that we discuss the risk factors, of course, with breast cancer, and make it so important that they need to talk to their physician. So what's some things that you are letting them know that they should be asking their physicians and doing to prevent breast cancer?
Yeah, you absolutely want to know as a woman if you have dense breast tissue. Cancers can hide in that tissue. Radiologists say it's like finding a snowball in a snowstorm. So, knowing if you have dense breast tissue, that's a conversation to have with your provider, as well as reading your imaging report when you receive it, because it will be listed in there. Other factors can be if there's a family history of breast cancer, and even as we age, our body changes, and women over the age of 50 can be at increased risk for breast cancer. But the number one risk is avoiding your mammogram. So the annual mammogram is so important, and I just encourage all women, go for it. Don't skip.
Yeah, very important. And Andy, again, as you being a health advocate for patients, quickly, how can we be our own advocate for ourselves?
I think the first thing is just have an open and transparent conversation with your physician. Let them know to make sure that you're seen, you're heard, you're understood, but more importantly, that you set clear expectations on what you want to get out of that exam. In addition, just like
Wow.
Michelle said, don't skip your annual screening or your annual exam. And in addition to that, make sure that you get a copy of your radiology report as well as your images, because we often know that patients don't necessarily see the same physician or go to the same clinic. And being able to bring that information with you uh, allows the physician to make sure that they're making the right diagnosis for you based on your history and your journey and your experience.
Yeah, I'll tell you, this is such a great topic that we need to continue on. So where can people find more information about the St. Luke's OneStop Clinic?
I, I would encourage people to go to gehealthcare.com/Christina Locator. And Michelle?
Yes, call 1-866 St. Luke's and hit option 2 for more information on the One Stop Breast Clinic.
Perfect. Thank you both for joining us.
Thank you.
Thank you.